Hello, I'm Brad Augustine with Hollander and Loan, and I just wanted to talk to you today as part of our resident transition series a little bit about disability insurance. So I'm sure that you've all heard a lot about disability insurance over the years because it's pretty ubiquitous within the residency training programs. Everybody knows that they need it. Everybody has their own particular reasons for getting different types of policies. So what I wanted to talk to you about today is the different types of policies that are out there and what exactly those would mean for you when you're looking to get coverage. So let's go through the three different types that there are. So there's three different tiers of coverage. Tier 1, which is the best, Tier 2, which is the middle, and Tier 3, which is the worst. Some people say that Tier 1 and 3 should be switched around. I don't really care how you think about it, just know that there's three different levels. Let's start with Tier 3, which is the worst level of the three. So Tier 3, which is also known as group coverage, is at the bottom here. This is what you probably have now as part of your residency program. Likely it'll be part of any sort of institution, hospital, office that you go and work for, is group coverage. What it looks like is it's 60% coverage up to either $5,000 or $10,000 per month of benefit. So let's use the $10,000 as an example, and let's say you're making $100,000 a year, just for the sake of an example. So if you were to get disabled with this type of coverage, you'd receive 60% of that, or $60,000 per year as your compensation. That would be a taxable benefit. So you'd bring home, call it $40,000 out of that 60. So that's fine. If you were used to making 100, you'd be bringing home 40. But you would still be making more than if you didn't have the coverage, but obviously it would be insufficient to be able to live the same kind of lifestyle that you were used to. So that's the first problem. The second problem is that after 2 years, if you have this type of policy, if you're doing anything else to earn an income, then the type of coverage that you have, this type of coverage goes away entirely. So as an example, if you were a greeter at Walmart, and you have this type of coverage, you would all of a sudden lose that coverage because you were earning an income someplace else. The problem with this is oftentimes when medical professionals are disabled, it's not like they're bedridden for the rest of their lives. You know, they still want to do something else, they just can't practice medicine in the form they were doing before. Usually the coverage is free. We'll take it because it's a free benefit, but basically since the beginning of time, people have supplemented it with something else. So let's move on to the next one. So again, using our example of the beginning of time, everybody used to get Tier 1 policies. Everybody used to offer them. You could go to any insurer virtually and they would offer you a top level type of policy. Now the only companies that offer that are limited to 5. However, after that transition happened of a lot of people leaving the business, there were a few that turned into Type 2 policies. There's only one company that still does that, and that's called Northwestern Mutual. With this type of policy, it's a little different from the third tier policy. In this case, what you have is they will give you a set amount of coverage per month. Let's use the example of $5,000 a month is what they say they're going to give you. Now, if that's the case, that money does come to you tax-free. So again, $5,000 a month would be $60,000 a year. Throw taxes back on there. It's kind of like making $100,000 again. That's better. However, with Tier 2 coverage, after 2 years, if you're making an income doing something else, they'll decrease the amount they're paying you, the disability company is paying you, by the amount you're making someplace else. Well, people might ask, well, what's the incentive for me to work someplace else? I don't have a good answer for you. So I tend to cross this type of policy off of my list. It also tends to be somehow oddly more expensive than good coverage, so just important to note. The top coverage, or Tier 1 coverage, is currently offered by 5 different companies. Those are Principal, MetLife, which became Mass Mutual, Ameritas, Standard, and Guardian. Those are the only 5 companies that will offer this type of coverage. And what this coverage does is it says in the contract, if you're not able to perform the material and substantial duties of your occupation, then you're covered. And that's important because if you're not able to perform specifically the duties of a dentist, physician, whatever it might be, then you have that coverage. So this could extend so far as to if I'm a radiologist and I'm not able to be a radiologist anymore, but I can teach radiology, you would be able to collect the full income from teaching radiology as well as the full income from your disability plan. Really important. These last all the way through till age 67. Another important distinction here is there are 2 of those 5 companies that are different from the other 3. The other 3 will offer you what's called limited mental nervous coverage, so 24 months of coverage. If you are too depressed to work, too anxious to work, you develop a drug or alcohol addiction, then they will cover you for 2 years. But after that 2-year period of time, you don't have coverage for that type of disorder anymore. You'd have to either get back to work or live without the money. There are 2 companies that offer unlimited mental nervous coverage. However, if you elect to do that type of coverage with those companies, it costs about twice as much. Last year we did probably 53 policies, and 2 of them had unlimited mental nervous, and it was because both clients were really interested in having unlimited mental nervous. So we don't tend to recommend that. As far as the intricacies of each different company, feel free to reach out with any questions that you have on that. We'd love to look through the contracts that you're seeing from those companies. We know them all pretty well. If you have any questions, always feel free to reach out, and we'll see you again soon.